Good afternoon, everyone. It is 3:31 and we will call this portion of the meeting to order, the business part of the, not the business part, the update part. And today we have Kelly Curl, who is going to do a health policy planning update for all of us. They've been working very hard. So Kelly, I'm anxious to hear. Take it away.
Sure, I'm happy to start.
Actually, Sherry, I'm so sorry.
Oh, we need to do the language justice first because we do have those folks on the line.
Thanks, Sherry.
Yeah, we do have the language justice folks on the line. We always try and be very inclusive and provide equity, and so that everyone gets to join the meeting and participate. And today we have Gisela.
Yes, thank you.
Thank you.
Hello, everyone. My name is Gisela Escobedo, and I'm here with Diego Pons, and we are with the Community Language Co-op. And I want to say thank you to the organizers of this event for your commitment to language justice. Thank you for giving an opportunity where people can participate and engage in the language of their heart, the language that they feel most comfortable in, that is the language that we practice at home. So to create this space, we're going to be using simultaneous interpretation. So when I finish saying this in Spanish, we will turn on interpretation and you will see a globe icon on the bottom of your bar that says interpretation. If you're not fully bilingual, I ask that you select your preferred language, if it's English or Spanish. And if you're bilingual, you don't have to use our services. Also, if you're joining us today from a phone or a tablet, it has 3 dots on the bottom of the bar that says more. You can click on it and then you can select your language as well. If you're going to be presenting or facilitating, please be aware of your speed. We know that Spanish takes 20 to 25% longer than English. Hola a todas las personas, mi nombre es Gisela Escobedo y estoy aquí con Diego Pons y estamos con la Community Language Co-op. Y quiero darle las gracias a los organizadores de este evento por su compromiso a la justicia del lenguaje. Gracias por dar una oportunidad donde las personas pueden participar e involucrarse en el idioma de su corazón, en el idioma que se sienten más cómodos, que es el idioma que practicamos en casa. Así que para hacer esto vamos a estar usando la interpretación simultánea. Cuando terminemos de decir esto, vamos a aprender interpretación y usted va a ver un icono de un globo en la barra de abajo de su pantalla que dice interpretación. Si no eres completamente bilingüe, te pido que selecciones tu idioma preferido, ya sea inglés o español. Y si eres bilingüe, pues no necesitas usar de nuestros servicios. Si estás hoy con nosotros desde un teléfono o una tableta, vienen 3 puntitos que dice más o more. Ahí le das un clic y luego puedes seleccionar tu idioma. También te pido que si vas a estar hablando o facilitando, sé consciente de tu velocidad para poder interpretar lo mejor posible. Muchas gracias. Thank you very much. You can go ahead and turn on interpretation.
Thank you so much, Gisela. And I also want to thank Diego, who always signs on as well. So thank you to the 2 of you. We appreciate everything that you do. Did everyone find their little world globe? All right, I think we're ready to go. Yes. Okay, Kelly Curl, take it away.
One second to get presented here. Awesome. Is that showing up with the full screen for y'all?
Yes.
Like I see a thumbs up. Yes, perfect. Thank you. Yes, hello, my name's Kelly. Thank you so much for sharing some time in your meeting today with me. I'm here to give you guys an update on public health policy planning at the department. Love to introduce myself. My name is Kelly Curl. I use she, her pronouns. I'm excited to be part of the JCPH team. I've been with the team now since late April, and I've really been impressed with the work that I've seen so far in my short time here. I have a background in a little bit of everything from emergency preparedness and response to maternal and infant health, tobacco prevention, community health improvement planning, most recently health communications, and I've worked in several different local governmental public health settings as well, with the Florida Department of Health across several counties there. and most recently come to you guys from the Larimer County Department of Health. So I'd love to share a little bit about what I've learned from all of our teams here, some ideas we have to move this work forward. We'll have time at the end, I believe, for questions, and I'd love to hear all of your feedback on what I share today, but don't hesitate to stop me either as we go through and ask questions as we go along. So today I'd like to provide kind of an overview of what the role of public health is in policy work, talk a little bit about JCPH's current policy work and the landscape that work is operating within, some of the broader context that we operate in and that our work is influenced by. And then we'll talk a little bit about strengths and opportunities that I see from what I've learned, talk about where my internal focus is currently at with some of this work, and the broader kind of high level vision of where I see this work going for the department. So why public health policy? Why do we get engaged with this? We've seen in public health that effective policies can have a monumental impact on health, improving health, protecting health. There's always improvements to be made. We know that policies can also create harm as well. And so really want to have a role in public health to implement and advocate for solid public health policies that help protect health and help advance equity and justice principles as well. We are tasked with it as public health in two different ways. It's an essential public health service, so it is an expectation and one of our core functions. It's also a standard that we need to meet to be accredited for public health accreditation as well. So my role was created, the public health policy advisor role was created when an internal group of staff came together to say, there really is a need here to have somebody to be working on policy broadly and not down into specific subject areas. We need this person to help coordinate our various policy efforts as that work is currently happening across many teams and divisions. Work on some strategies so that we can be monitoring and ready to actively engage with policy when opportunities and needs arise. And then work across the department, work with our partners to help develop a long-term policy strategy that fits within the department's public health priorities. So thinking about the landscape that all this work is taking place in, I'll start with where we're seeing our staff and our department engaging with the work. We have different teams within JCPH who have a large focus on policy in various subject areas. So this includes our tobacco prevention team, our food policy team, communities that care, environmental health, harm reduction, all have a big focus of their work around policy. We also have teams that have a big role in policy, even if that's not their primary focus. So teams like health equity, community engagement, health communications, that may not be like the main focus of their work, but their work is critical to the success of policy work. And then many teams and individuals across our department also work in larger collaboratives that work on policy. So this is groups like CALFO, the Colorado Public Health Association, other local and municipal kind of coalitions that advance policies in different topical areas or for different populations as well. So it's happening across teams and across individuals within the department. And the actual activities that those groups and individuals are working on spans the full gamut of levels of policy, everything from a federal policy level down to the municipal level. And this slide includes some of the different policy activities we're currently engaged on. It's by no means a comprehensive list, but provides some really good examples. And our teams have a role either in kind of monitoring and just being aware of potential policy change that may be coming, to actively working on advancing and promoting a particular policy approach, or maybe the adoption of a model policy as well. At the federal level, our teams have been doing a lot of work to monitor certain federal policies, including some FDA proposed rules that would prohibit the use of flavors in cigars, and menthol as a specific flavor in cigarettes. We're also monitoring a Health and Human Services rule that would adapt a non-discrimination rule within the Affordable Care Act to further strengthen that rule. And then we're also monitoring some EPA potential rules that may be coming soon that would further limit the community's exposure to PFAS substances and ethylene oxide, which can be detrimental to health. At the state level, we're monitoring certain ballot measures that may have a public health impact. This includes the School Meals for All measure. There's a measure related to psychedelic substances and some alcohol related ballot measures as well. We're working to understand what those would look like if they do move forward after the election. We're also supporting and a partnership between our tobacco team, Gilpin and Clear Creek counties, the state health department, and others to do some enforcement work and better understand the requirements within a particular aspect of the Clean Indoor Air Act in Colorado as it pertains to certain casinos in those counties. It looks like the majority of that action is going to sit with the state health department, but our teams are working to help support where we can, since those are counties we serve under our contract. And then within our emergency preparedness division, Anjanette Hawkins is working to better understand the state changes as it relates to ambulance licensing. Colorado is one of the last states to move from a local ambulance licensing structure to a statewide licensing structure. So that policy was adopted in the last legislative session and is now working through development to actually create the licensing structure. So she's tapped into that process. At the county level, we're looking to be ready to support the county if the referred marijuana questions move forward so that we can help the county in implementing that. We're also exploring some interest in a potential tobacco retailer license for unincorporated portions of Jefferson County. And Jim Rada and some others with the department are working with the county on the county's new climate action plan, which is currently in development. And then lastly, at the municipal level, we're involved in several different ways. In Golden, we have a lot of activity going on around how they intend to use their marijuana taxes from their new retail marijuana ordinance. They have some interest in a couple different areas that have a public health focus where they might want to use those funds. So we're partnering with the city on that. Our food policy team is looking at how they might be able to expand the success of their healthy beverage policies to other municipalities that might be interested. And our communities that care team is currently reviewing some policy options that would target underage hosting as it relates to youth substance use. And then throughout all of these activities and levels, we're trying to actively monitor and respond to changes and new priorities as they come up and build relationships along the way and strengthen relationships along the way as we go. Another important piece of the context that our policy work operates in is the advocacy work of our national public health partners. So these are groups like NACCHO or the American Public Health Association, ASTHO, which represents state health departments, Trust for America's Health. And all of these groups have specific policy priorities that they are focusing their time and resources on. And some of these are shared across these groups, and some of them are more specific to a particular association. And what we really see as a widely shared priority for advocacy right now in policy is shoring up the public health infrastructure. There's a huge focus on that right now across all these groups. And that looks like strengthening and developing the public health workforce, modernizing our data systems so that local level data translates to state level data, translates to federal level data, and maintains quality along the way. And looking at how we can have more flexible and sustained long-term funding so that we don't have, in the example of COVID, there's an emergency, we get funding that's very specific to that emergency. And then after a few years, it's gone. Looking at how we can have that long-term sustained funding that isn't so topically focused so that we can be nimble and adjust and meet local needs on a long-term ongoing basis. Many of these groups are also focusing a lot of work around racial and health equity, looking at policies that address social determinants of health, root causes, addressing and dismantling structural racism. Some also share the priority of trying to improve access to care through either lowering costs of care or increasing healthcare coverage. And we're also seeing some focus on public health preparedness. I think that predated COVID, but COVID has certainly highlighted a need there. And then these groups also have some specific topic areas such as gun violence, climate change, and the public health impacts of that, healthy aging, mental health, substance use, misuse, to name a few. We're also maintaining awareness about the election and just understanding what changes may come as a result of the election. We're nonpartisan, we're not engaged in advocating for or against candidates or ballot measures, but wanting to be prepared so that when the final decisions are determined in November, we'll be ready to engage as needed. So looking at candidates, many of our state level representation are up for election in November. And redistricting is changing some of the districts. So there's some folks that previously covered portions of Jeffco that may no longer touch Jeffco, or people who remain connected to Jeffco but now cover communities they didn't previously cover. So we'll be able to see soon, I think, what the effects of that redistricting is going to look like. And that'll be statewide, but especially as it pertains to Jeffco. And then looking at ballot initiatives as well that have a tie to public health. So looking at things like the School Meals for All initiative, the psychedelic substances initiative that would decriminalize and create regulated access. There's also an initiative around affordable housing. And then the three last ones you see there that relate to access to alcohol in our communities. For more detailed information on these, I'd refer folks back to the Blue Book that's published by the state. Those were mailed out. I received mine, I think, a couple weeks ago. It has a great kind of short overview of all of these, along with sections with more detailed information. And if folks don't have that yet in their mailbox, it can be accessed online in English, Spanish, and there is an audio version as well. The election has officially begun. Ballots have been mailed to certain groups, I think now for a few weeks. And then the wider mail out ballots in Colorado, that started yesterday. So we would encourage folks to register to vote if they're not already registered. We'd also encourage them to make sure that they're up to date on their registration so that they don't have any issues receiving their ballot or voting if they choose to go in person. And doing that's a really fast, simple and secure process in Colorado. The Jeffco elections page has a lot more information about days you'd have to register by to get your ballot by mail, when they'd have to be returned, if being placed in the mail, all of that sort of information, and where you would go to register or update your registration. So I would check that out as a great resource for folks if they want to participate. So given that landscape, I think there's a number of strengths and opportunities for public health policy work at JCPH. Our strengths include we have a wealth of staff expertise here and experience in policy work that we have, I think, tapped into, and we could continue to do so. We've got strong local partnerships, and I think we're all ready to go out and continue to build those partnerships, create new ones, do deeper dives into building partnerships with community members as well. And the department has a great history of incubating really strong local coalitions that often take a role in advocating for public health policy. And we also have a deep portfolio of public health policy successes that we can lean on moving forward in our policy work. There are some opportunities I see as well, and these are, some of them are incidental and some of them are more ongoing. Our community health assessment process is currently underway, and there's a lot of opportunity there to collect more input and feedback from our community around policy and then incorporate that into the next phase, which would be the community health improvement planning process that will start next year. We're also going through reaccreditation as a health department through the Public Health Accreditation Board, and there are measures, as noted before, on how we engage with policy work. The department is also doing ongoing and rolling strategic planning, which gives a great opportunity if there are strategies that make sense to include as part of our strategic planning efforts. And then working to develop our clear priorities for policy and the values we want to use to guide our policy work as a department. So where I'm spending my focus right now are on public health accreditation, not only to make sure that we have what's needed in place to actually submit through for reaccreditation, but taking those measures and those practices and seeing how we can make sure that those are embedded as a standard of practice for our policy work and not just something that we're using for this one particular need. With the community health assessment process, working with our data and epi team to do key informant interviews with certain elected officials across the county to get their perspectives on community health in Jeffco. And those interviews right now are proving to be providing really valuable insight from those leaders. And there does seem to be interest so far in meeting with them to remain engaged in the process. So we're hopeful that that engagement follows through past the assessment into the health improvement planning process as well. Also looking at developing department values around policy. In meeting with our teams, it was really clear to me that many of them have very clearly defined or implicit values that they work from when they engage with their policy work, but there hadn't been an effort yet to bring those teams together to say, hey, let's all operate from the same set of values, as many of them were shared values as I was having conversations with our teams. So this morning, we actually met to workshop some of those values. What do we want to prioritize as we approach our policy work? And how do we want to operationalize that? And started that conversation internally with our teams that touch policy. So that's still very much in draft. We'll be pulling together that brainstorming effort into a more synthesized set of values that should be available soon as our teams finish up their initial input into that process. And then lastly, in meeting with our teams, there was a very clearly articulated need for some guidance around how we engage in policy activities. Our teams do great work and they want to know that this is the clear process and the clear expectation about how we engage with that work and what the limitations are so that they can make sure that they're operating within those limits. So we have drafted some policy guidance that includes things like relevant laws we need to follow, like the Fair Campaign Practices Act, as well as some funding and contractual restrictions that go beyond that piece of law that we need to follow based on somebody's funding as well. And that will include some clear internal processes for our teams to use for some specific activities so that folks understand how that process moves forward internally. So I really see that our policy work is moving in the right direction. I think there's a great deal of interest and investment in our teams to bring this work together and work collaboratively and strategically around policy. There's a desire to see this rooted and clearly articulated and shared departmental values that span across teams and divisions. We really want to see this work aligned with the department's overall priorities and have it really be guided by clear processes and expectations for our staff. I think there's interest and investment in doing that. And I think we have all of the right tools and resources in place for us to move that forward and achieve this vision in the long term for our policy work. I'd love to hear any feedback you all have and take any questions you have about what I've shared today.
Questions from the board members? Anyone? And just give me a wave if I don't see you.
I do. This is great. I think this is foundational. The policy work is so instrumental in setting up a system that makes the public health choices the default choices. And there's been so many efforts that have been successful over the last several years and many more that are still needed. So, and that's thinking at the state level. But I'm also interested in how, if this within the bandwidth to work, locally within the county and thinking about having health in all policies. So as we work with land use and other departments, making sure that we have walkable communities and we are not instrumental in setting that up, but it absolutely impacts health. So looking at all the different other connections to health across what the county does and comprehensive plans for municipalities and things like that, so that we're really trying to set things up for success. Again, building codes, that are pro-environment and supporting public health. So those are, I guess, other interests and if that's something that you think is kind of within the scope of what you might be working on as a policy team.
Yeah, absolutely. And I think we've had some very initial expressions of interest at this point of trying to figure out how we, incorporate that more comprehensively across our policy strategies. And as we come together as teams to work in alignment and work in collaboration, I think those opportunities are really going to get illuminated through that process. Some of our teams touch those upstream things maybe more so than others. And I think as this work unfolds, we'll be able to lean on those teams from their experience and their successes and build that across. So yeah, I do see that shaking out as part of this process as we work to get more organized and develop what our strategies overall are around policy.
Thank you. Thank you, Lane, for the question. Kimberly, you have your hand up.
Yeah, thank you. Kelly, thank you. Excellent presentation and extremely informative. And these are the types of presentations I think that really help board members, and I'm speaking for myself, but to really kind of have a clear understanding of what you all are working on so that we can sort of assimilate it into conversations we're having with community partners or others that might be able to participate in several of these activities. I just have two questions. One involves the re-accreditation. I know I brought this up in the past, just circling back and making certain that the board is included in the activities that will be evaluated that demonstrate a more active role and participation within JCPH. And then the other one was the community health assessment. I know you said that interviews are going to be being held with some key stakeholders. Has the rest of the CHA been done? And if so, is it possible for us at some point in the future to get a little bit of feedback regarding that?
Yeah, I guess to your FAB question, I'm not sure what the overall, like how the overall reaccreditation outcomes and documentation and execution of submitting for that is going to be brought back to the board. I'd refer you to our new FAB coordinator for that. And in looking at the community health assessment, I know that for the elected leaders that I'm meeting with, we've committed to making sure that they're looped in as soon as the assessment results are available, and we are publicizing those. And I can't imagine that the Board of Health isn't also included in that dissemination plan, but I can't speak to that in terms of the details as well as our data and EPI team could. But I know that the assessment is underway and my interview process is part of that effort.
Okay, thank you.
Thank you. Hilda.
Yes, hi. Thank you, Cherry, and thank you, Kelly, for the presentation. And I am sorry, I think you mentioned what they mean, but there is a few acronyms that I'm not familiar with, and I will let you explain them.
Yes,
because I saw a few acronyms in your presentation, like PHAB, CHA, CHIP. What those acronyms mean?
Yes, and thank you for pointing that out. I could have done a better job there of pulling those out completely on my slides. The PHAB is Public Health Accreditation Board. So they're the accrediting entity for public health departments who move through the accreditation process. And we call it FAB for short. CHA is our community health assessment. And that's the step that precedes our community health improvement plan. So the health assessment is a wide-ranging collection of community health data, community health perspectives, and input about the status of health in Jefferson County. And then that information is fed into a collaborative and community engaged process to identify health priorities that the county collectively wants to address. And that health improvement planning process will begin next year after the assessment's complete.
Perfect. And the CHIP?
The Community Health Improvement Plan.
Oh, okay.
Yeah.
Thank you. I'm sure the interpreters appreciate that description of the acronyms, since it's kind of hard to understand what they mean. Also, I gotta say that I wasn't completely aware that the JCPH had a policy component. So I'm kind of really happy that you're here presenting, and I'm just wondering if you can give me a really kind of big overview about how you guys or how your team promotes or oppose ballot measures. How is that process? I know you mentioned a few in there, and a couple of them I'm familiar with, but as a department or as a team, how you guys either promote or oppose some of those measures?
Yeah, so as government employees, we're subject to the Fair Campaign Practices Act, which dictates activities around campaign finance and political activities within the state of Colorado. And that act stipulates that we can't do any work to promote or oppose a ballot measure once they've been referred to ballot, in the same way that we can't take a position on a piece of legislation when it's introduced into the state legislature. So we can't and don't do work that works towards or against the ballot measures. But what we're doing is trying to understand what the measures are and how they might operate, so that once the election results are determined, depending on what shakes out of that, we're prepared to engage as needed, because many of those measures tie to public health.
So what I understand is that the function that you guys have is more as education for the department and on how those different measures impact the department functions, and also educating the public. Is that a correct assessment in my part?
Yeah, that's a fairly close representation of our role. We haven't, as I understand it in the time I've been here, we don't do a whole lot of proactive education around the ballot measures so much as just being prepared to engage with them after they move out of the election phase. So once the results are determined, depending on what those results are, if these measures move forward from the voter decision, we would need to be engaged. And so the work we're doing now is more around being ready for that engagement, depending on what the results are.
Okay, perfect. And I know we have somebody that is gonna do a public comment regarding the food for schools. I think that is the measure, the FF measure. So we'll be able to, I'm sure you're familiar with that initiative. So we'll be able to hear a little bit more about that.
Yes. Yep.
Thank you so much.
Yeah.
Lane,
Thanks. Kelly, you mentioned the restrictions on ballot initiatives, but you also said you can't advocate for legislation that's introduced. So that is not my understanding. So can you maybe I know we're out of time, but I guess I'd like to follow up on that piece about staff not getting involved in legislation.
Yeah, and Carrie may be on this call and she may be able to speak more to the details of that. And some of that's what we're trying to determine with the guidance that we're developing around where those clear boundaries are. As I understand it with Fair Campaign, if a bill is introduced into the legislature, we can't urge a decision maker on that legislation to take a position on it while it's moving through the legislative process.
Yeah, I mean, I think it's essential for testimony, especially at committee hearings for public health. And I know that has been something that public health staff have done for many years. So anyway, that would be good to get clarification and make sure that staff are active, because waiting for policy to be made versus influencing it is something that we absolutely need to be influencing it, if not leading it in some cases.
Yeah, I agree.
thank you. Okay, any other questions from the board members? Well, Kelly, we really appreciate your time, and that was very informative. And I agree with Kimberly. Those are the good things that the board needs to hear. And then I also, Hilda, thank you. I'm with you on all of the acronyms. It's like I try to, okay, let me just remember. It's hard to follow. So thank you, all of you. And thank you, Kelly. I appreciate it.
Thank you so much for your time.
Absolutely. Okay. It is now 4:03 and we're going to adjourn the first portion of that meeting, and we're going to go right into our business meeting, which always begins at 4. So with that, we will call the meeting to order. Lindsay, would you take the roll, please?
Sure. Hilda Gerke.
Found it, present.
Okay, great. Kimberly Kropick.
Present.
Lane Drager.
Present.
Sherry John.
Present.
And for the record, Harriet Hall is absent and a quorum has been established. Thank you so much.
Thank you, Lindsay. Okay, let's go right into our agenda. We're going to first do the consent agenda. Is there anything on this consent agenda that any of the members would have questions on that we need to pull it off and have a discussion? Okay, seeing none, then we will I'll ask for a motion to approve the consent agenda and a second.
I'll move to approve the consent agenda.
I second.
Thank you. All right, all those in favor, please say aye.
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 Aye. Any opposed?
Abstain.
Abstain?
I wasn't,
Okay.
yeah, I wasn't there last month.
Okay, thank you, Kimberly.
Mhm.
Okay, we can move on. It does pass with one abstention. We have got 3 people that are signed up to speak. And I'll remind everyone, as these 3 obviously did, that when you do want to speak at a board meeting, we ask that you always go on the website and sign up to speak. I believe we leave it open until 12 or 1. the day of the board meeting, but that gives us a chance to figure out the timing and really stay on task. We have a pretty full agenda. So right now we're going to open it up to the 3 people that signed up to speak, and we'll give each one of them 3 minutes. Lindsay, would you call the first person, please?
Sure, Haley Nelson. And Haley, you should be able to unmute yourself.
Awesome, great. I'm not able to turn my video on, but hi everyone, my name is Hallie Nelson and my address is 4321 Ames Street, of the Jefferson County Food Policy Council, and I'm here today to ask the Board of Health to support the passage of Proposition FF, Healthy School Meals for All. We shared a letter with Board Member Hilda Gerke asking the same last week. Our Food Policy Council is a nonprofit supporting a collective of over 260 individuals and organizations in Jefferson County, and our mission is to influence policy to increase equitable access to healthy, local, and affordable food and support a sustainable community food system. Our council members, including farmers, food pantries, activists, food businesses, and others, voted to Proposition FF, and our council is a part of the Hunger Free Colorado Organizing Committee for the ballot measure. During the pandemic, when the federal government paid for school meals, Jeffco Public Schools saw a 30% increase in the number of meals served, proving that when school meals are free, more students are able to access food. We know that students need nutritious food to achieve their learning goals and also to build the foundation for lifelong health habits. We also know that more than 60,000 students in Colorado can't afford school meals, but don't qualify for federal free or reduced price lunches. This year, the federal government is no longer paying for the cost of school meals. With the passage of Proposition FF this November, next year, state funding would pay for school meals across participating public school systems in Colorado. Proposition FF not only supports students to access food, also supports school districts to pay staff, receive training, buy equipment, and buy local foods to support Colorado farmers and ranchers. The Jefferson County Board of Education voted unanimously to support the passage of Proposition FF on September 15th, 2022. And today we ask you to do the same. Food is a human right, and our students need access to free, nutritious meals at school to build lifelong healthy habits and to be able to focus on learning. So we ask that the Board of Health hold a vote to support the passage of Proposition FF, Healthy School Meals for All. Thank you for the time.
Thank you, Haley, or Hallie, excuse me. Lindsay, would you be sure to call the next person, please?
Sure, James Trovinger. And James, you should be able to unmute. And James also submitted a written comment, so maybe he just wanted to do that today. Just give you a few more seconds here if you'd like to address the board, James.
It does not look like it. We will make sure that we have his written statements recorded.
Yes, and then we had one more person signed up for public comment, but I do not see him, Matthew Cobb. And so Matthew, if you're on under a different name or maybe a phone number, maybe Mike's iPad has their hand raised. So we'll see if this is, you can go ahead and unmute.
Hi, how's it going? I just wanted to ask, I found out about this meeting today and I haven't been to a public health meeting. Is this the time for comment for general business or new business that we can bring up, or is this specifically what was already just brought up by the speakers?
So this is public comment, but you did need to sign up before. But Sherry, if you want to go ahead and let him provide public comment.
Yeah, we will. I hate to open up the whole, but we will this one time, Mike, just for you. We will take public comment from you. 3 minutes.
Okay,
please.
I appreciate that, but I believe there's an Ann LaFoon and Lynn Clemens on the call. I would just be echoing their comments, so I could just give back the time if that helps.
Sure, whatever you'd like to do.
Are they signed up to comment though?
No,
No,
no, they're not.
Oh, okay. Well, then I'd just like to make a quick comment about the possible grading permit and the movement of the Farmers Highline Canal where the old AMAX facility was. We're just hoping that Jeffco Public Health can take a good look at that. I'm not sure if you know the background of that facility, but there was numerous experiments on that land, including extraction of uranium from ore, as well as some other coal and coking process experiments. It was nominated for a Superfund site, but never designated as such. But still, there is a healthy list of different cleanups and other activities done that you can find at the Colorado Department of Public Health and Environment. Fonda from that department is looking at the voluntary cleanup program. And they're also looking at right now to move the Farmers Highline Canal, and they would need a grading permit. We definitely would like if Jeffco Public Health could take a good look at all that information and provide comment. Thank you very much.
Okay, thank you.
thank you, Mike. Lindsay, we do have people that have put written comments in, and we aren't obviously going to read all the written comments, but would you like to just quickly give us their names so that we all know who wrote in?
Sure. Holly Nelson, Brian Marshall, Bo Goldstein, Dennis White, Anne LaFoon, James Trovinger, Roberta Trovinger, and Christy Rich.
Thank you. All right, we will close public comment and move right on into our financial report. Salma, I believe you're going to give the financials today.
Yes, I am. I'll be sharing my screen shortly. Hello, everyone. Can you see my screen? And can you hear me okay?
Yes.
Awesome. Hello, everyone. Today I will be presenting the September financial statements. And as of this reporting period, with 75% of the year complete, our total revenues are being reported at 12% below budget. And this is mainly because of our grant revenues. At this time of the year, we are anticipating that most likely we will not use approximately 3.6 million of our grant revenues. This is primarily due to one of our major awards, ELC Round 2, which is a $10 million award. So we are anticipating that we will not spend 3.6 million this year due to scope limitations that are imposed and some restrictions imposed by the sponsor. And since this award is really specific to contact tracing, case investigation, and testing. However, I do want to highlight that we're not necessarily, these funds, the 3.6 million that we are not anticipating to bring, it's not, although we're not bringing it this year, it's not expiring until July 31st, 2023. So if we do receive scope adjustment from our sponsor, we might be able to draw down from these funds next year. Our charges for services are ahead of the budget by 6%, and this is because of our vital records. The Vitals team managed to bring over $112,000 of charges for services or mortuary revenues this year through September. In terms of our expenditures, we are also behind of spending by 12%. And this is also due to the scope of limitations for the ELC Round 2 funds. Since we don't have those expenditures, we don't have those revenues as well. We also have some other savings, some other vacancy savings from the executive director positions, as well as other positions that we are in progress of recruiting as well. Supplies, we continue to surpass this line item, as well as the direct assistant line items due to funds reallocations from other line items to these lines. And also, I do want to point out that we only budgeted minimal funds under these line items. Other charges for services are ahead of the budget, just slightly ahead of the budget by 2%. Capital projects and equipment are below budget by 10%. Intergovernmental, these are payments to state that are associated with vitals and restaurant licensing revenues that are also ahead of the budget by 5%. and cost allocation charges are ahead of the budget by 5% as well. In terms of county transfer, we've utilized to date 60% of our county transfer. Although this might seem behind the budget by 13%, I do want to point out that we are reserving approximately $650,000 to cover the first pay period of January, which tends to fall January 1st. So most likely all that pay period is going to be moved to December 2022. That's all I have for today, unless if you have any questions.
Board members, are there questions?
I have one.
Kimberly.
Hi, Salma, thank you again for such a clear update on this. Regarding the $3.6 million we're anticipating not using this year, with the expiration date of July 31st of next year, when would we know if we'll be able to draw down and use that in 2023?
So we do have the funds available throughout the award cycle. The issue with the specific grant is that it's only tied to contact tracing, case investigation, and testing. And because of the level of response required, we don't anticipate that we would use the entire 10 million unless if we receive scope of work adjustment from state to utilize these funds towards other services. So coming next year, if we receive that scope adjustment, we might be able to draw down additional funding. Otherwise, we won't be able to spend the entire $10 million.
So would that scope of adjustment be submitted now? I mean, in the months leading up to the end of the year, or is that asked for in July then? I'm unclear of that.
Unfortunately, we have been asking for scope of adjustments or to allow for additional services, but CCPH does not have any clarification. They are also, I believe, receiving the grant from CDC, so they haven't received any updates on how is that going to look like or whether or not there is going to be any adjustment. We continue to ask, and we also continue to ask for an award extension, and we haven't received any updates yet.
So it's basically in the hands of two organizations that don't have that information yet.
That is correct.
Thank you.
Thank you. Any other questions?
Are there other questions? Okay, seeing none, I would take a motion to approve the financials.
I move to approve the financial.
Second.
Okay, it has been moved and seconded. May we have a vote, please? All those in favor, please say aye.
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 Any opposed, please say no. Okay, that passes. All right, moving into old business, Joe Vanelpour, he's going to give us an update and review the feedback and finalize all of the letter of termination for the CTC update. Joe, are you with us? There you are.
I am. Good afternoon, everybody. So I'd like to briefly revisit the conversation around transitioning to a new fiscal agent for the Communities That Care program. As discussed previously, and transitioning fiscal agent as well as relinquishing funds currently managed by JCPH. So as discussed in previous conversations, JCPH is managing 3 awards under the Communities That Care umbrella. Those include 2 awards under the sponsoring agency of Colorado Department of Public Health and Environment, the state health department, essentially. Those 2 awards are the Community Organizing for Prevention Award and the Health Disparities Award. There is also the Center for Disease Control's award for drug. It is the Drug-Free Communities Award. Apologies. So again, we are managing 3 awards as we're having this conversation, as we are collaborating with Jeffco CTC, as well as the Jeffco Communities That Care, as well as the Colorado Nonprofit Development Center, we are trying to move forward with this conversation and transitioning these funds, again, relinquishing funds from JCPH. We continue to have open conversations, trying to be as transparent as possible and collaborating with the various agencies that are part of the conversation. Again, the sponsoring agencies, the new fiscal agency, and again, these conversations are continuing to occur, some on a weekly basis. At this point, we need the notice of termination, to make very clear that JCPH is intending to terminate our existing award. The one in particular is the Community Organizing for Prevention Award, in order for the new fiscal agent to apply for that funding. So it's kind of establishing the process, the formality behind the process to allow that funding to become available, and for the Colorado Nonprofit Development Center to apply for those funds. What I'm asking the board at this point is to review and to vote on the letter of notice of termination. Sorry, I'm trying to get all of these pieces together and get them all right. Again, this is intended to be a very brief update. There are still many variables that are being figured out at this time. One item in particular that I want to draw attention to is the time frame in which we are stating to the state health department that we are relinquishing these funds and terminating our contract with CDPHE, and that is the December 31st, 2022 deadline or date. That date has been widely discussed, and it is a result of CDPHE, the state health department's timeframe to consider and evaluate the application by CNDC, the Colorado Nonprofit Development Center. So although we are all very eager to move forward in this process, we are learning very quickly, and we have learned over the last couple months that this is a timely process. This is not something that we could address in a very rapid manner. There are many pieces to consider. One in particular is, I believe, one of the concerns of the Board of Health is that to ensure that these programs still flourish, that these programs still move forward, and there's not a disruption of the handing off of funding, that we put all these pieces in order in a timely manner. My intention, or our intention, is to have a more lengthy conversation, to provide more details at an upcoming Board of Health meeting. The intention of this conversation, this item on the agenda, is just to bring to attention the Board of Health, to bring to the Board of Health's attention this notice of termination, and to address any questions that you may have at this point. So with all that being said, are there any questions that I can help address?
Questions from the board? Kimberly.
Joe, I'm certain this is just going to surprise you, but I'm confused. So
I was coughing because of the coffee, not.
Oh, okay. So this letter does not impact the award that was under CTC for the health disparities part. It just involves, and I was trying to write as fast as I could, the community organize, just one section, one of those awards is, and I've read the letter a couple of times as well. So it's just a component, it's just one of the 3 awards, and there'll be more discussion later on the other 2. Is that okay?
That is indeed correct. Kimberly, thank you for your question. Again, these are awards, grants that overlap, that cover efforts that are covered under these various grants, these awards. So untangling this to some extent and ensuring that the program still thrive is is more detailed than as it originally appeared. But yes, to answer your question, this is indeed one award that we need to provide notice to the State Health Department of our intentions in order for the other pieces to come into play. I hope that helps. You're welcome. Thank you.
Any other questions? Hilda, do you have a question or a comment?
Yes, thank you, Cherry. I do not have a question, but I do have a comment, and I want to appreciate your involvement, Joe. And I know you guys are working really hard to make this happen, and I know it's not easy, but this is a commitment that we make, and I really appreciate you guys working really hard to make this happen. I know it's not easy, but I think it is going to be worth it. Appreciate it.
Thank you, Hilda. And I will just echo that, Joe. We all appreciate that because it is such an incredibly important program. And untangling the way grants are written and how they're awarded is not an easy process. So I really appreciate the work that you all are doing to make sure that we can see that this is a success for everyone. Thank you.
Well, let me jump in really quickly. Thank you so much for those comments. I do want to state, I believe my part in this conversation is the small part, is the administrative piece. So the effort in these conversations is tremendous. There is a long list of staff members that have contributed long hours and frustrating conversations. This truly is a collaborative process, and there are a lot of members involved in this conversation. So thank you for those comments.
Thank you, Joe.
Can I do a follow-up? Yeah, can I do a follow-up on that? And I know we're in the middle of this, but I'm wondering if it's also a good opportunity to learn how to make this process in the future for other programs that want to become their own independent program. I feel like this is a great opportunity for everybody involved to learn some lessons and make this process a little bit more streamlined, if possible. I know it's a lot more complicated than I can even think, but I don't know. I feel like this might be a good opportunity to make sure that if we have something happening in the future is a little bit more painless, if possible.
If I could very quickly, I can't tell you how much I appreciate those comments. And we are learning as we are going, we are reflecting on the process, and we are looking at a lot of the sticking points, and to ensure that if this situation occurs again, where we are transitioning, that we approach it in a more seamless manner, but also reflecting on some of the sticking points on our business process internally. So there's a lot of room for growth that is constantly part of the conversation. It is something that we've been evaluating along the process. So Hilda, thank you for those comments.
Jody, I see that you have your hand up. Do you have some conversation to add?
Yeah, just a quick follow-up to that. It's a great question. And I think as an organization, we need to take a philosophical look at whether this is something we want to do moving forward. If we want to intentionally have programs that we start here and then move out into the community or move out into nonprofits. You know, there's resource issues related to that. There's all kinds of questions about that. We're good at it. And I think we could be better at it. And I think if we're going to do it in the future, we need to be intentional about it. So definitely appreciate the comments.
Thank you. Okay, are there any further questions from Joe, or can we let him go?
I do have a comment. If we could please make sure that we formally approve the notice of termination so that we can move forward with this process.
Oh, yes, you do want an approval of the termination letter. Do board members have any discussion on that, or are there any comments? And if not, I would accept a motion to approve the termination letter.
I motion to approve the termination letter for CTC.
Has been moved. Do we have a second?
Second.
Lane has seconded it, and all those in favor, please say aye.
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 Okay, that motion passes unanimously.
Thank you, everyone.
Joe. There you go. You have been approved. Okay, now we're going to move into some new business, and it's really exciting. I'm very excited to have Dan Cummings with us. We're going to go through the executive director recruitment discussion and objectives. And Daniel Cummings, you are with us, and I'm going to turn it over to you.
Thanks, Sherry. Great to be with all of you. I am at a conference in Tucson, so pardon my dress. We were out doing a salsa making competition, so I didn't want to wear a nice dress shirt, coat and tie, but normally I can show you pictures to prove it. But great to be with you all. We're honored to be working with JCPH on this important search. And I need to defer to Lindsay for a second, or Sherry, I'll ask you the question. Have the board members all received the draft document that has been worked on regarding a position announcement, position profile?
I am
Yes.
reasonably sure.
Yep.
I guess we would ask, have anyone not received it? Okay, everyone has received it. All right.
Great. Well, that's wonderful. And that document was a result of conversations I conducted with many of you, and also with your senior leadership team members who were very great in dedicating time to talk with me about it. Had some really good conversations with them. As you all know, the job description doesn't allow a lot of poetic license. I tried to put some information in about Jeffco and specifically about JCPH that I could exercise some literary license with, but the job description itself has to be pretty standardized. So that document is something I'm hoping that we can get approved and move forward with, because that would be the first step that's the checkered or the green flag, I guess I'd say, on the search. That's our starting gun, not to use too many different metaphors here, but that's when we'll actually start doing outreach and research into potential candidates. And I'll reiterate something I mentioned to all of you that I got a chance to talk to. Hilda, we missed connections. I'm sorry about that, but the others I spoke to, you'll recall I mentioned, if you think of any names, and I'll reiterate this again, please don't hesitate to reach out to us. You don't have to know they'd actually be candidates. Frankly, a lot of people we talk to, for a wide variety of reasons, will decline to raise their hand themselves. But the next question we always ask is, who do you know that could be a fit for this role? So it's like casting pebbles into a pond and letting the ripples fan out. And eventually we're going to encounter a very, very good candidate, or several, hopefully, for you to choose from. So that's the process. And Sherry, I'll ask you again, because I see Lindsay's on mute. Did you all get the proposed advertising and posting plan that my colleague Tamara prepared?
Yes, I think we received all of it. And I have asked Lindsay if she could please put everything up on the screen. So as we talk about this and there's questions and we can have discussion around this. So that will kind of help you guide you along too, and answer the questions as we go.
Okay.
Do you want me to put up the, let's see, the brochure or package first? Or do you want that? Okay.
Let's start with that, Lindsay. And it's not 100% necessary, Sherry, that we get sign off, but I'd like to just kind of let everybody look at it. It's very similar to the one you did a few years ago. I think maybe we've updated salient facts in it, or, quantifiable things, but the communications team at JCPH did yeoman's work on that. So we really appreciate it. They turned it around really quickly. So.
Thank you.
So beautiful images of Jeffco, just to make it, I think that's probably, just south of Ken Carroll there, if I'm not mistaken, but, that beautiful images, the verbiage is very standard, again, to what you've seen before. Put the mission, the vision, and just some information about JCPH in there as well. So again, perhaps all of you have already had a chance to look at it. I don't know what your weekends were like. I'm sorry if we added homework to your weekends, but I would like to get this document signed off by all of you at our earliest opportunity. It doesn't have to be at this meeting. You may want to take it and review it. And I don't know what the vehicle is, Sherry, to, I know we have to be cognizant of public meetings and the like. So, but this is something that we'll use, and I want to have it in final form before we go public with the search. So.
In answer to your question, I would like to see if we can't, since everyone does have a copy and have had a chance to go through it. Plus, it's a lot of, the stuff that we have gone through before in hiring. I would love to see if we can't get this approved today so that we can get moving on this.
That'd be fantastic.
It's very important.
Does anyone have any questions about the content in there? If you've had the chance to look it over, or you may be looking it over now. But again, it is verbatim, with the exception of the parts I could editorialize on a little bit, but it's been vetted by Lindsay. It's been vetted by your internal communications team, but it's important all of you feel very comfortable with it because this is your search. So.
Board members, as you read through this and looked at it, did anything jump out at you, or is there anything you wanted to see changed or added or taken out?
Thank you, Cherry. Hi, Daniel, and I'm sorry we miss each other, but I really appreciate all the work that you have done. And you mentioned already that you had the opportunity to speak with some of the current current employees and the ACPH, and I imagine some of their desires or some of their input is embedded in here. I don't know if you can recall a couple points where you specifically hear from the people who are going to be directly impacted by this hiring process. I don't know if you can point out some of or highlight some of those points there.
Hilda, I did have the opportunity to speak to everybody on the leadership team that's still on the leadership team, with the exception of Jody. He recused himself, but I was able to talk to everybody else. And because the job description has to comply with the state mandates, there isn't a lot that I changed, and well, there's nothing I changed in the job description itself. It's more background information for me as we're doing outreach and research into potential candidates. So everything is fairly standard there that you see on this brochure, but there's color, I guess I'd say, in my head from the conversations I had with Joe and his colleagues on the leadership team. So.
Okay, perfect. Thank you. And one last question, because I know Kim have another question. Can you also point out any aspects of this brochure where invites people with diverse backgrounds to apply? So we have a big pool of candidates that we can choose from.
We actually have two mentions of that in here, Hilda. I think I see Lindsay is scrolling, and there is a section that we talked about, inviting candidates of diverse backgrounds, diverse ethnicity, gender, all different kinds of diverse candidates to apply. And Lindsay, I can't direct you to exactly where that was. I know it's in there. And then at the very end, we also have a statement about that JCPH and EFL Associates jointly, have taken the position that we're not going to discriminate on any of these, protected categories, and that all candidates are welcome to apply. So.
I think it was more towards the bottom, Hilda. If you have yours in front of you, I think it was because I read that too.
And Hilda, it's this third paragraph specifically for equity. And then, yeah, as Dan had mentioned, and Sherry, down at the bottom here, the non-discrimination.
Yeah, right under the
the non-discrimination policy. Okay, perfect. Thank you.
Sure. And to that question, Hilda, I always tell people this, I have one lens when it comes to a search, and that is qualified. That's the only lens I use. And we want to have the most diverse array of candidates for this board to consider. And I mean diverse in terms of backgrounds, diverse in terms of education, experience, ethnicity, gender, sexual orientation, whatever it might be. We want to have the only lens I look at is, are these people qualified? So.
Thank you. Thank you.
And frankly, where qualified comes from, there are certain things we spelled out in this brochure, but it's certainly colored by what I heard from each of you and the senior leadership team as well. So.
Thank you.
You're
Kimberly,
welcome.
you have a question, Kimberly?
Yeah, I'm hoping that one of the staff one of the nurses or one of the clinical staff can unmute with this question too. Could you please go up to the picture of the child? I'm an adult practitioner. I'm going to just preface it with that. I'm just wondering if the picture of the child receiving an injection, there you go. That's a really big needle. And so if the clinical staff's okay with this, I will heed to them. But when that came up, it kind of took me back just a little bit, because I'm used to giving injections with little kids with much smaller syringes and needles. So if there's anybody, director, anybody who wants to jump in there and tell me to be quiet or support whatever, that's really, I think you guys have done a really good job of being succinct, being clear, and so I'll leave it at that.
Thank you, Kimberly. I thought I didn't say anything because I just have this thing on phobia, so I just kind of put my hand over it. I have a phobia on needles, so thank you for saying that, because I kind of thought the same thing, was like, oh, yikes. And I don't know if there's anything else. The other thing, the question I have, and it literally is a question, does having just a picture of this keep the public, well, I guess we're not doing the public, we're doing just candidates for looking at candidates to hire. I just want to make sure that they don't, whoever it is, they don't think that we just do this portion of health, because there's so much too. There's mental health, there's, the environmental stuff, there's all of this stuff in when you're talking about a health department. But I guess this is really just for the people that would probably know this.
But Sherry, not to interrupt you, I think that this space would be better served by a picture, I don't want to say a cartoon, but a picture that does depict something that looks at environmental health, something that looks at clinical care, something that looks at partnership, because when it's right next to these preferred qualifications, I just think that, I don't know, that I think that picture is not something I would prefer to see, but like I said, I'll leave it to all of you all.
Yeah, I would agree.
Well, I'm certain we could have Noella and her team change that picture out. I'm guessing she'd like some direction from us. So, Sherry, to your point, as you and I talked when we had a chance to visit, there's so many things that fall under the umbrella of public health, and we're trying to encapsulate it in one image. Is there something you guys would like to see there, as opposed to that young girl getting I hadn't noticed it, Kimberly, but that is a pretty darn big needle. So, and I'll give that little girl credit. She's looking right at it. I'd be staring out the window.
Yeah, no.
biting into a penny or something. So,
no. Well, I think Kimberly makes a really, that's kind of what I was thinking. It's like, this is, we want the candidates and everyone to know of all the incredible things that a health department really does. It's not just about vaccinations. It's not just about, do you know what I'm saying? And right now, everybody's mind was just trying to leave just solely the COVID stuff. And so to include it is fine, but maybe a little bit more broad. And I'm sure Noella is just great. Her and her team are just wonderful. So I'm sure that she can reach out to me. She can reach out to Kimberly, Hilda.
Okay.
Mhm.
Um,
I saw Wynn Rodman coming on the camera. I don't know if she has a comment or would like to make a comment, but I just saw.
Thank you, Hilda. No, I don't really have a comment. I was just going to talk about the needle size if you wanted me to do that. But I think that you guys have moved on to a different image. So we'll save this poor little person.
Sounds good. Thanks.
All right, so Lindsay, can you coordinate with Noella and just mention we'd like to change out that image, and if she wants some direction, Sherry can be available.
Yeah, no problem.
Thank you. You're so good. Do you want to move on to the recommended posting? And if by the way, if anybody has any edits to the verbiage here, you know, I realize you may be seeing this for the first time, so let us know, because we'd again, to Sherry's point, we'd like to get this finalized as soon as possible. So
today would be great. Lane, you're our eldest member as far as how the length of the board. Do you have any comments since you've been through this type of stuff previously?
I didn't see that attachment, so that is helpful. I didn't see that in the board packet.
It's towards the, you have to keep scrolling. It took me a minute to find it too.
So it's not with these other documents. I think once I got to all the expenses, which is like, I maybe I still don't see it. I see all the, yeah, I didn't see that in there.
so
mine jumps after that, all the brochure components.
Are you able to pull it up now?
I don't see it in the packet.
Okay, Lindsay, can you maybe just
PDF.
resend something to Lane so that he can?
It goes to the minutes of the previous meeting right after the last compensation document, and then it goes into all the expenses. There's like
okay.
Hey, Lane, are you talking about the document that I have up right now?
Yeah, I don't have that in the PDF.
Okay. Right. It was emailed yesterday. Tamara sent it to me over the weekend, so I emailed it to you guys yesterday, but I can quickly email that back to you.
I probably have it then. I was looking at the board packet.
Okay, Daniel, do you want to go through any of this? Members, do you want to discuss any of this? Looks like they quite reaching.
We don't want to post anywhere without your express approval. Many of these were well, my colleague Tamara put this menu, if you will, together, and many of them were venues that Lindsay had shared with us that you had posted in the past. From some previous public health work, the health department work we've done, we added a few sites that we thought from that search. And Tamara will do LinkedIn job posting. That's the top one. She also, I want to emphasize to you all, we're not simply waiting on people to respond to a posting here. We're going to be doing targeted outreach. Again, you all gave me several names to talk to. I'll track those people down. We'll talk to them. Hopefully they may raise their hand themselves, but the next question, like I said, I always ask is, okay, if not you, who? And so we will look for referrals from that. But this is just a way to augment what we're doing. It's a way to publicize the opportunity to get the word out there that Jeffco is seeking a new public health leader. And, you know, many of these are free. I think, Lindsay, if you scroll down maybe to page 2, there's a tabulated total of what the, you know, all doing each of these postings would cost. There it is, from 1959 to 2300. That's not a huge investment, but you know, it's your decision on whether you want to do that. And this is not a buffet. Well, it is a buffet, I guess. You can pick and choose. It's an a la carte menu. There's some we can do, some we can skip. We can always come back and do them later. But given the time frame, you know, ideally, I'd like to see us do all of these, and we'll augment that, as I said, with our own research and outreach. And that's primarily Tamara's domain, and she's an expert at it. So.
I agree with you, Daniel, on the fact that we should tackle all of this at once, especially because we want this to move fast. But I'm curious why you only budget for 30 days. It is going to see what happens within 30 days and then we can renew it, or?
That's absolutely right, Hilda. Some postings, you know, the usual minimum is 30, some are 60, but Tamara and I just kind of taken the stance, let's do 30. We don't need to do all of them for 60 because the cost would presumably almost be double. So let's see what's working, what's not working, what our own research and outreach is bringing in. Then we might revisit this and, you know, need to renew a few of these beyond that 30-day period. So.
Sherry, this is Carrie Markle. May I ask a question?
Sure. Carrie, go ahead.
One of the things that Hilda just touched on is the idea of deadlines and timeframes. And under open meetings, as you guys know, there needs to be at least an initial setting of deadlines for applications and a time frame. And understanding, as Daniel and Hilda just discussed, that could be a very much a fluid concept, but I didn't see in any of the written materials that we're looking at that discussion, and I would just encourage the board to have that discussion with Dan now at some point during this conversation.
Sure. No, that's great, Carrie. Thank you for bringing that up. So I think there's two. I mean, this menu of options is important, but we won't post anything until we know the position specifications are approved. So if we're going to change out an image, and if you see any verbiage you want to change, it's important we do that step first, because in the postings we do, we keep those pretty short, and we include a hyperlink to the document to invite interested parties to go one step further, click on the hyperlink. You can review the much more detailed brochure that Lindsay had up on the screen a little bit later. But I do know, you know, as Carrie said, we need to talk about timing, being thorough, being intentional about this. And the other thing, Sherry, I'll just broach, and we can, you know, your agenda may not allow for it today, but we need to talk about how the senior leadership team and the staff at JCPH will be involved in this process. When and how is important to at least be thinking about now, because I know all of you greatly value the input of the leadership team and the staff they lead. And we want to, this is a huge impact search or hire for them. So we want to be mindful of that. And it's appropriate to involve them to a point, but ultimately the board is the fiduciary. It's your decision. So we have to kind of walk that fine line. And Sherry, you and I talked about that a little bit in our call. So Carrie, is there anything else you want me to broach about timing and, you know, just sensitivity to open meetings laws and those kinds of things?
And I think you've covered it. I think, though, that in order for this, if the board is intending to act today, in order for it to be effective, there needs to be a discussion around deadline, at least initial deadlines for applications and a timeline for selection. That's part of the statutory mandate. And absent that, I think that that's what I would suggest.
Great. Okay. And Carrie, if we find we've set an arbitrary deadline, can it be amended then?
Sure. Absolutely.
Okay.
The board acts and the board can amend its own actions.
in most searches, I'll just say, I don't set an application deadline, but I do a lot of work in the public sector, as I think you all know. And so, if we need to set a deadline for this one, we can do it. As we just determined by my question from Carrie, we can always adjust that if we feel like a little more time would buy us that much more in the way of potential candidates for you all to consider.
And the way I've seen that addressed, you're the expert and the professional, Dan, but I've seen the initial deadline for, initial review of applicants will be on such and such date. The position opening is ongoing. But that is really for the board to decide. And I'm going to stop talking now so that the board can.
And ultimately it will be the board's decision. I would generally advise any client I'm working with, client organization, it takes a good 30 to 45 days to to adequately scour the market, to get word out, to get people to respond, to actually apply. So if the position specs were approved today, or the brochure, I'll say, the advertising was approved and we could go live with that, Sherry, I don't think it would be unreasonable to set a deadline of, let's say, December 1st or November 30th or something, as a line in the sand to say applications need to be received by this date. We can always revisit that, as Carrie confirmed. So.
Okay, Lane, you have a comment?
Yeah, I'm very comfortable with the materials. I'm very pro immunization, so I don't want to send any kind of mixed messages that needles were scaring people. That I don't think anybody on the board also is saying we're not supportive of the immunization efforts, but
No.
I don't want to micromanage the marketing piece. I think I want to stay in the big picture piece. I want to follow also your recommendations. I don't want to put arbitrary things that are going to hurt us too. So if you feel comfortable, I mean, I've also seen positions that are open until filled, so you're not giving something. So I don't know if that's off the table, but I want to make sure we're not tying our hands by putting something arbitrary that isn't actually going to achieve the goal, which is to get robust candidate pool. So, but I want to make sure to give the green light. So I don't have issues with the marketing sites that you've chosen. I think I agree. Why wouldn't we do all of them? It's not really that big of an expense. So I'm supportive of all that. And then, yeah, if you do feel comfortable with a December 1st, I'm fine with that as a motion. But again, I don't want to put something that is tying your hands.
Thank you, Lane.
Yeah, thanks, Lane. I think as long as we have that option to revisit it, I have no problem. I mean, more times better. I'll just say that. But we want to light a fire under people and not have them hem and haw forever. So as long as we've got the option to extend it, I think that I would feel comfortable with December 1. But if you want to say December 15th, that's fine too. So,
Kimberly.
I just want to, first of all, Lane, make it very clear, I was not saying anything about vaccination and us not supporting it. I was just, okay.
I just wanted to put that on record.
Okay, and I wanted to make that clear too. So I also wanted to ask, I thought that it was possible to post something on the CDC as well, that people can go in and job search by state for specific career and job things there. I don't know how much it costs, or if you've ever done that, or if it would be appropriate here. I was just wondering if that had been considered and taken off the list because it was either cost prohibitive, or it was felt by another team working on some of this that it wasn't a place we wanted to go to.
from my standpoint, Kimberly, I'd say we didn't even think about it, quite frankly. We should have. And I didn't know what what kind of system they might have. So, if it's an option, there was no intentionality in leaving it off. Let me just say it that way.
Okay. I'd encourage maybe you all to take a look at that.
Yeah.
And get it on. Again, I don't know what the cost is. So I'll leave it at that. Thanks, Dan.
Thank you.
And I have a comment or a question. Would it kind of wrap everything up if we did 45 days for posting, but then keep it open until the position is open?
That's good.
Is there a way that to write anything like that? So that we don't.
Usually in the positions post or description, and Lindsay, I don't know if you can pull that back up on the screen or not. Usually we have, review of applications will begin immediately. The position will be open until filled. So I usually put that verbiage as opposed to establishing a set deadline, but some of my clients like to have a set deadline, and so we've adapted to that. So if you go down to the very bottom, Lindsay, the last page, application process, referrals and review of applications will begin immediately and will continue until the position is filled. The last sentence of that application process. So that's typically the standard verbiage we use. But again, I have clients that want to have a firm deadline and need to have a firm deadline. And so we've adapted to that. So.
Hilda?
Yes, thank you, Cherry. I was gonna comment also on the deadline and the time. What I understand by Carrie is that we do need to put a date, and in my opinion, December 1st is too soon. I think we should extend it for even longer than that, especially because holidays are coming and a lot of people are not necessarily looking to find a job during this time. So I prefer to move that deadline if we have to establish one for next year. I agree with Lane on the fact that my preference is if we can approve this today, and with the sense that we're going to make those maybe changes and modifications, but I'm a little worried about setting up a date on December 1st, and then we're going to have to change it already next meeting. So my preference will be to move it to next year.
Other comments from board members? If you're saying you would make it longer, Hilda, are you thinking like December 15th, December 30th?
No, I was thinking next year, like January or February of 2023 as a deadline to apply.
Now that does seem long to me.
Mm-hmm. I mean, we are almost at the end of October or the middle of October. November is starting, the beginning of the holidays. So
we were hoping to have somebody in place probably by January 1. Kimberly.
Yeah, Sherry, I agree with you. I think what I heard Dan say, and you'll need to correct me if I misunderstood you, was that, and Casey as well, is that we can put a deadline of December 15th or December 1st on it. And if we don't have the adequate pool of individuals who meet our qualifications, or that we think it's a strong enough pool of individuals, we have the option to then go ahead and reopen it or continue it. Is that a correct understanding? And if so, at what point do we need to make certain to communicate or change or shift the extension of application acceptance, and by what process do we do that? So it's kind of 3 questions.
So Kimberly, this is Carrie. That is done by a board meeting. A special board meeting could be called. You can do that very quickly. If, let's say you get to the end of November, and there have not been applicants, an adequate pool of applicants for the Board of Health to consider. That can be coordinated fairly quickly through Lindsay to conduct a special meeting that's noticed to address the issue. It would not necessarily have to wait, in other words, for a regular rescheduled Board of Health meeting to be addressed. So at this meeting today, for example, you could, as part of your, if you decide to identify a date for initial applications to be submitted, you could also in that to, say if that the Board of Health would extend it if adequate applicant pool is not submitted by the deadline, and would meet again to set a new deadline. I mean, that is all within the board's purview and power to do via a board meeting, but it would not need to wait until a scheduled regular meeting to do that.
Kimberly? You're on mute.
Thank you. That it's really helpful. And I just want to say from past experience in recruiting, there are probably at this point in time several individuals who are probably looking at public health career opportunities. And from past experience, the longer you leave it open, the individuals who apply first and who may be some of your strongest candidates end up taking their thing back because other organizations have moved on them, have moved their processes faster. And I would ask us to consider that when we consider if we want to move this into January or February.
Kimberly, I think that's a really good point, because I will tell you that when they require so many months or whatever, when they put these postings up, I know in the government realm that they do this, by the time they make their decision, this person says, oh, I started someplace else 2 months ago.
Right.
I mean,
right.
that is an issue. And thank you for bringing that up. Lane, you have a comment?
Yeah, maybe it can even get us to move forward too, is I just would propose that we set a December 1st, we'll have a November meeting. That's a time for us to check back in again. If we need to extend it, we can extend it. But I agree that with the timeliness, as we are hopefully seeing candidates, even maybe by the next meeting, that would be fantastic, that we don't have to sit and wait for some arbitrary timeline to start moving forward on candidates that we feel strongly about. So I guess I would move with some minor tweaks, as the board has already mentioned, on sort of pictures, to approve the documents that we've seen and the posting sites, and then just set December 1st as our tentative timeline, and we'll revisit that at our next board meeting.
Thank you. A motion has been made. Do we have a second?
I would second it by adding the statement that Carrie gave us regarding the extension should a adequate pool of candidates not be established. I don't know if we need to put that in the motion, but I second it.
Well, that would be an amendment to the motion, so.
Oh, whoops, sorry.
Yeah, no, that's okay. Just take it as an amendment to the motion. Any further discussion?
Yeah, we also had the suggestion by Kim about posting it in the CDC. It's also included on the sites that is posted.
What I'd suggest is that we investigate that, and Carrie would, how do we get approval to do that?
Well, I think that because we've already asked that you do that, I have every faith that you will do that. And then you can maybe let the board know. I don't know that we need to specifically put in a motion that we ask you to do CDC. I think that's an excellent point, Kimberly, and I think that they'll do that. Okay, any further discussion? All right, we have a motion before us and we have a second. All those in favor, please say aye.
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 Right.
Any opposed, please say no. Motion passes. Your work can begin.
Thank you.
Daniel,
And good luck with the salsa.
take it and run. Yeah.
And again, I'll reiterate, I realize when I ask the question, sometimes it's a bolt out of the blue. You don't know it's going to be asked. So as you ponder this and think about this person's worth talking to, I welcome those kinds of referrals at any and all times. So please keep them coming. So.
Okay, what, I just want to make sure that we all understand the next steps. Oh, and Lindsay, I'm sorry, Lindsay, you have a question?
I do. Sorry to interrupt.
No, we need to make sure it's real clear for you.
And I'll make sure to send out, once I work with Noella, I'll make sure to send out the brochure with the updated picture as well to the board. But I think, Dan, did you ask the board if they wanted to discuss what staff involvement looked like for the recruitment?
Yeah, I did ask that, Lindsay, with just the proviso that I think it's worth, the cart is way ahead of the horse at this time to talk about involving the staff. So it doesn't necessarily need to be decided today, but I do think it's important that we start thinking about that because we want to be intentional. We want to involve the staff at the appropriate juncture. I think I speak for the staff in saying they want to be involved at the appropriate juncture, but I'll just comment that there's a way to handle it and appropriately, and there's many more ways to do it wrongly. So it's something I'd love to be involved in discussions with you on that. And that's probably something we could talk about at your November board meeting. So
we'll make sure that gets on the agenda.
Okay.
Great.
Well, while it's been brought up, I guess just to share my perspective, I would like to see staff involved, maybe some representation in either a first or, as we've kind of got maybe a finer pool versus looking at every candidate that applies, start to involve staff. I think certainly for final candidates, where there's an opportunity for them to present sort of their vision, I think those are other important steps, not just for staff, but for our partners too. So that we really have kind of robust feedback going into that.
Yeah. And to tag along, Lane, I want to mention that I also would like to see people who applied, not only people who you selected. So we make sure that we see all the candidates, not just the one that are being selected. So I just want to add that comment. And I agree. I would like as much involvement as possible.
Thank you, Hilda.
Okay. And so just very briefly, Daniel, will you just kind of give us the very next steps, kind of how you'll proceed and make sure that we all are on the same page?
We'll get Lindsay will talk to Noella to get that picture changed out and get it in a final form that everybody's good with. I hear the verbiage is fine. We just change out that image. We'll reach out to CDC and find out what our options are to post with them. The rest of the menu, if you will, has been approved. So as soon as we know the position specifications are done, Tambra will make the postings, get those up. We'll have the hyperlink in there, and frankly, we're off and running at that point, Sherry.
Okay. Board members, are there any comments or questions before we move on to the next agenda item? I don't see any. Daniel, thank you so much for taking time out of your conference and for just being so great to work with and so responsive. I'm very impressed with how quickly you respond to things.
Well,
so
thank
I
you,
really
Sherry.
appreciate
It's
that.
nice. And I really appreciate the time of all you that you've all invested and with me on the phone, and certainly that of your senior leadership team as well. I'll tell you, I came away from those conversations very impressed with the team at Jeffco Public Health. So you've got a great team there. We just need to find a great leader. So
yeah. Thank you. Thank you for
thank
your
you
time.
all.
Yep.
Have a good rest of your meeting.
Thank you.
Mm-hmm.
Okay. we are going to go to the senior leadership teams. Jody, you're up first.
Thank you. Good evening. And I have some notes I'm going to refer to tonight. And I just want to briefly update on some things that happened over the last couple months that honestly got me really excited. And I know sometimes people say I'm excited all the time when it comes to work stuff, but there's been plenty of times in the last couple of years that that wasn't the case. But really in the last couple of weeks, some things just kept hitting me. And I kept seeing some things day after day that I really wanted to talk about that got me feeling like, for at least me, I've turned a corner. And I think for the organization in some ways we have as well. So I apologize. My computer has been kicking me off these platforms all week. So if I disappear, please move on in the agenda. And also for all the staff who've heard me talk nonstop about these things the last 2 weeks, I apologize that you have to hear it again. We've heard a lot that public health is changing. The world has changed, honestly. And we have a lot of people that say we can't do things the way that we've always done them. It's time for change. And so we're taking advantage of all the change that took place over the last couple of years with everything that we've been through as an organization to build back a better public health department and a better system in a lot of ways. And really this starts inside of our own department, which is where we've been focusing the last 6 months. It's actually been a part of our strategic plan for the last 3 to 6 months, doing a lot about staff recovery. Again, as we came out of COVID, just taking a lot of the time. We have so many people with a lot of time accumulated, time to spend with family, get outside a little bit, catch up on things. And things now, as we go into the fall, for some of us, I think are starting to feel a little settled down. For some folks, I know that's still not the case. And I just really want to acknowledge that. But again, I've just seen some things that got me excited. I've spent the last many, many years listening to amazing ideas from many brilliant people. And now it's time to make a lot of those things happen, which is exactly what we've been doing. If you talk to any workforce expert right now, they will tell you that people coming into the workforce, they want more than just a paycheck. Joe says it all the time. Our county HR director says it all the time. Any journal article you read says people want more than a paycheck. And people are still negotiating salaries. They're still negotiating benefits. We still need to be competitive in that regard. County's doing a lot of great work around that. But people want to be a part of big things, of decision-making, of conversations. They just really want to be included in the process. And so we've talked about for years being the employer of choice. The county's talked about it. That's not easy. It's a huge shift. It's a very different way of thinking, honestly. And we've been trying to do some of those things, starting with the senior leadership team over the last several months. A couple examples. The other day, a candidate said, if I can't get the salary I want, can I have access to a leadership mentor? We have a very strict salary policy, compensation policy, honestly. We're trying to create equity across the organization. And this person said, well, can I negotiate some leadership training, some leadership development? I said, absolutely. And I actually knew they were going to ask me that question because of the questions we asked them in the interview process. I knew they were interested in leadership and that this was something that they wanted to maybe fast track on. And by all means, let's make a plan. Let's talk about it. Let's be intentional about it as an organization. When you see all the turnover in public health the last 2-3 years, let's really be intentional and thoughtful as an organization. Even if they don't end up here as a leader in a leadership role, every question I've developed for the last 2 years and dozens and dozens and dozens of interviews, I've been thinking, and every interview I've conducted, every person I've talked to, I've been thinking, how long would it take me to train this person to be the next executive director, to be the next division director, to supervise this program? What can we do very intentionally to get folks that are interested in that and can move into these positions? So we're very intentionally supporting leaders. We're connecting them with mentors. We have a great grant through the state where we can send people to Regional Institute for Health and Environmental Leadership, the Jefferson County Leadership Program, and all the great trainings, Cloverleaf process that the county offers. The thing I may have mentioned this before, people are burned out, but we've been hearing, over the past few months, if they can be a part of something like reimagining public health, that would get them energized. They could find time for that. And so that's really what we've been trying to do, is take advantage of folks to say, We have some big decisions that need to be made. They need to be made quickly, and we want you to be a part of it. Not just helping us pick from, we come up with 3 things as a senior leadership team, and we want staff to vote on them. No, we want to give them big problems and have them come to us with solutions. And it's something, again, it's a change, and it takes time. There's still some growing pains, but it's just, we're starting to see that turn where folks are really getting on board and volunteering to take on some really, really neat things that are helping us redefine how we operate as an organization and how we operate as public health. So quicker decision-making. And I don't know if I was reading an article or somebody said to me the other day, the days of people coming to you with an amazing idea and being told, well, fill out this form, and then here in a few weeks, maybe you can come present it to us. Then, we'll talk about it for another month, and then maybe we'll make some changes to it. People don't want that anymore. And those days are gone. They want to hear, make it happen. And we're doing just that. And it's kind of interesting how many times I've heard in the last 6 months, wow, you have 6 or 7 people on your senior leadership team. That must be difficult when it comes to decision making. Actually, we've gotten really, really good at it. We're making decisions faster, more efficiently and effectively than ever before. And we're engaging sometimes 20 people, 30 people. We did just last week, we met with the leadership team in the clinic, and we said, we need feedback from everybody in this division. And let's say we'll meet again in just over a week and talk about it. Within 3 days, we had feedback from everybody in the clinic and we're able to make a decision and move forward. So it's been really cool to see how it's just kind of changed the model. I do need to say that not every decision can be made that quickly. When I mentioned this on another call the other day, had some people suggest that every decision should be made quickly, but it's not every discussion. Some are more complex, hiring an executive director, updating regulations, but the ones that we can make more quickly, we are. And it's already demonstrating value. We refined our strategic plan to be more easily implementable, and we've accomplished or almost done with over half of our projects that we put on that strategic plan. And that was in July. That's by far the most success we've had in a strategic plan in the 7 or 8 years we've been doing it. And it's just been in 3 months. Major projects, because it's being staff driven. And we even have people coming to us sometimes saying, this isn't what we need. This isn't how we want to approach this. And that's when we have to kind of step back and say, okay, if this is what you feel as a working group, that we need to take a different direction on this, run with it and come to us with a recommendation. A great example of this is our health communications plan. In all my years here, people across the state have used the media and communications materials we develop. We've been an exceptional resource for countless organizations. It's still happening. That team doesn't get all the credit that they deserve. So I just want to point that out, that they deserve an immense amount of credit. And a couple of weeks ago, they presented their communications plan for the next year and a half to us. It's connected to our reaccreditation process. It's one of our strategic projects, so we knew it was coming. We could be ready with our questions. And then when they presented it, the entire senior leadership team said, this is exceptional, make it happen, how can we support it? And this plan captured things we've been talking about for years, as well as many new ideas and things that people have been wanting to do for a long, long time. And the communications group, they're paying attention. They knew these things, and they even took it. This is by far the best communications plan we've ever had as an organization. So you'll be seeing more about that. I stepped into a meeting a couple of days ago where work was being done on our health equity plan by our health equity team. And somebody who doesn't work at Jefferson County Public Health said, this plan is going to be a statewide model. And they were very excited about it and convinced, and wanted to make sure they told me that it was going to be a statewide model with the work that team's doing. So we're also, in addition to kind of this trying to change the way that we make decisions as a system and the way that we operate as a system, we're also integrating adaptability into our leadership. And I want to specifically call out Jim here. About a week and a half ago, he came to me and he said, I want to talk to you about an issue that was brought to me by one of Carrie's supervisors. And so when Carrie announced her retirement, she did a fantastic job of working with her supervisors and saying, who's going to be the best resource for you? Where's the best connection going to happen here? And work to kind of assign people from the senior leadership team to support those supervisors. And before Carrie was even gone, Jim was already having really meaningful conversations with one of the supervisors and coming to me and brainstorming some issues with me about it. And I know that's happening with many of our senior leadership team and the supervisors on that group. We implemented this kind of adaptive model about a year and a half ago because we had no choice, all the turnover we had. It's not ideal to say, okay, for the next 2 months, you're going to have this supervisor, then we're going to shift you over here when we get somebody hired. But we're getting better at it. And what it's doing is when we finally get things settled down when we hire all the positions we still need to hire, get them onboarded, it's going to make us a lot closer as a organization. We're going to understand each other's programs better, and it's just going to make it that much easier for us to work together. So a lot of cool stuff happening, in the senior leadership team, the leadership team across the organization, which is one of the other things I should mention too. We've been having monthly meetings of all supervisors, program coordinators for my entire time here. 15 years. And a few months ago, some supervisors came to us and said, this isn't working for us. Typically, we go around the room and do updates, or we talk about the strategic plan or the community health assessment. And they said, we want to really completely retool the way this meeting works. And we said, thank you so much, go for it. And they worked through coming up with a purpose statement. What's the reason that we're having this meeting? What does this group do? And why are we even, we don't want to meet just to meet. So another just a cool thing, a cool change that's going on. At Public Health in the Rockies, I had multiple people walk up to me and say, tell me about these jobs you have on your website. And this is one of the things that has me the most excited. They said, I hear you're doing great things over there, and I would love to come work for you. And this job that you have posted is something I've kind of been dreaming about for a long time. Tell me more about it. What are you looking for? And I said, we're looking for people who can live in some gray area, deal with a lot of change, but they want to be part of something big and really truly a high achieving, high functioning, cross-organizational team. We want you to build your dream division, be a part of a team that's going to help us build a dream public health department. And to some people, that's not appealing. They don't like gray area, but a lot of people really do. They're looking for that challenge to really implement their own vision. And we have now before the family services, before Carrie's last day here, we'd already closed our 2-week recruitment. We already had a team that was put together in family services of folks that would be on the interview panel. We had questions developed for the interview process, and we were already setting up scheduling times to screen candidates. And we've already got that done. And we have 3 just absolutely fantastic candidates for that position that we're moving forward and interviewing next week. So those are just all the kinds of things that are really just getting me thrilled that we had a huge pool of candidates for that job. And I think more and more we're going to start seeing that as things settle down. So having people help us figure out where you fit in the organization. Kelly Keenan left recently, and we gave her team the opportunity to say, who should be your supervisor? What do you want to see in a new supervisor? Where should your program sit in the organization? Do you want to stay as a single team? Do you want to, separate this out some way? And they went to work and they came back to us and said, here's what we'd like to do. And that's exactly what's going to happen. So just imagine that being, a year into an organization and somebody coming to you and say, help us define what this looks like and for the next 10 years, what your job's going to consist of. So that's what people are looking for. And if we want to compete with organizations that are doing just amazing things across this country, those are more and more the kinds of things that we need to do to really, really, truly engage the workforce. Some people just want to do their routine work. That's fine too. We just want to let's get people in here that can support that as well. So
I don't want to cut you short, but I am impressed with all the amazing things that you all are doing. And I know you're excited.
Yes.
I know you're excited, but we also want to hear from the other.
One last point, and I didn't go last month, so I'm going to take a couple extra minutes. But this is just the very beginning. And if we stay on this trajectory, things are just going to continue to change dramatically for this organization. So I'm very thrilled about it. I had to share it. And if you have any questions, I'd love to answer it. But otherwise, I do know that the other directors have a lot to share as well. So thank you.
Well, thank you. Joe, I think you're up.
Thank you. I don't have anything specific to discuss, but we'll take the opportunity to say how grateful I am to work alongside such an amazing team. Thank you, everyone.
Well, we're glad we have you too. Okay, Jim, you're up.
Oh, good afternoon, everyone. I have just a couple of things to share today. First, the distinct honor to announce this month's Employee of the Month. And he was on the screen earlier, but I think it's after 5 o'clock. So Steve probably has finished his day. But Steve Jackson, environmental health specialist with the Environmental Health Services Division, is the Employee of the Month for October of 2022. Want to share a few things that some of his peers at the department have stated, but I think it's a ubiquitous feeling amongst the division staff of all of the compliments that you're about to hear. During the pandemic, Steve was assigned to the Public Health Order Enforcement Team, a very difficult team to be on, and had the difficult task of issuing notices of violation, closing facilities down, and he rose to the occasion and did his job with tremendous consistency and fairness. He also took on the review of special events during this time, which had specific public health order requirements that needed to be followed. He never shies away from asking the difficult questions to get the answers needed for the team. In fact, when he came to Colorado, he brought with him a wealth of education and experience in in swimming pool inspection. And he immediately stepped up and took on a leadership role in environmental health services, sharing his extensive knowledge with his coworkers and operators. Steve stepped up taking on environmental health inspections in Gilpin County, adding to his already heavy workload in a county where that was significantly behind in its required inspections. Steve has demonstrated that he's efficient with his planning, with planning his time so that he accomplishes the maximum possible on most days and in a very effective manner. He has a knack for calming operators down, which is a tremendous skill in the work that we do, and helping them understand what is needed to comply with regulation. When asked to do the large childcare camps inspections in the county as a joint team, he took this on without complaint and helped the childcare inspection team accomplish a big task. In June of 2022, we also had a Legionellosis outbreak at an apartments complex, and Steve was instrumental in assisting with the investigation and ensuring that the pool facilities were being adequately treated to minimize exposure to Legionella. If a teammate or a customer needs his help, he addresses it immediately, whether it's conducting a last-minute regulatory inspection in his area, finding resolution and connecting operators with resources, or connecting with the right person or department if they're unsure of the answer. Steve started with JCPH 4 months into the pandemic and had many challenges that he needed to overcome to do his job virtually and learn what we do at Environmental Health Services. He didn't come with a background in food inspection. He didn't have his primary responsibilities where he came from in Florida were swimming pool inspections. And so he took on the challenge and went after it with a full heart, and he learned very quickly. He's a reliable, adaptable team player, always lending a hand and willingly adjusting his schedule to be available when called upon, demonstrating his resilience and can-do attitude. Steve continuously shows up actively engaged, ready to serve and protect public health, always seeking to contribute to the collective good and humbly taking responsibility for the work that needs to happen. We are so grateful for all of his hard work and his efforts, and it certainly has not gone unnoticed, especially by the Environmental Health Services Division staff. So I'm very pleased to share that with you. Steve has been a great addition to the team, comes to us with over 10 years in environmental health from Florida, And so we're really, really, really happy to have them. Thanks for that. The only other thing I wanted to share with the board today, again, is a quick update on the climate action planning process that has been shared with the county department staff from all over the county to get input on, and then it will be, and it also has been, the draft plan, I should be saying, has been shared with the steering committee, the Climate Action Planning Steering Committee, of which we have a number of staff members participating in that steering committee, along with Harriet Hall. I'm hoping Harriet, while she's out enjoying traveling or wherever she's at, is sitting there reading the climate action plan and marking it all up and giving us great input. Following, I think that is, the comments from the staff are due at the end of this week from county staff. And then it will go out to a public review once any adjustments are made. We're hoping to have that process completed sometime in mid-November. I'm hoping that either November or December, we would be able to bring a briefing to the Board of Health to share with you where the plan stands, and with the hopes that the Board of County Commissioners will receive the plan in December and approve it by the end of the year. So that is my report.
Well, thank you, Jim, and welcome, Steve. Okay, Gwen.
Hey, Sherry, I had just something. Jim, we got quite a few comments about sort of property. I'm not sure if you've been looped into that, but if you could maybe take a look at those and share some thoughts back with the board. I'm not sure what active roles we have in doing or even ordering site assessments are, but maybe if there is any role that we play in advising land use processes, that would just be helpful, so the board understands what roles and authorities we do have versus what we don't have.
Yes, just very briefly.
Thanks.
I just became aware of this issue today at about 2 p.m. It has gone through, actually, I think tomorrow was the deadline for public health comments. We are a referral agency to the Planning and Zoning Department on a number of different types of land use applications. We have provided comments to the Planning and Zoning Agency. The activities that are going on that site do not require a planning commission or a Board of County Commissioner approval or public hearing, not at this stage anyway, as I understand. So there has been quite a bit of work out there. The county planning and zoning folks are working on a grading permit and a site development plan. And it really is in the planning and zoning administrator's hands at the moment.
Thanks, Jim.
Mm-hmm.
Thank you. Okay, Gwen.
Hey, thank you. I just have a quick announcement. I think everyone's already aware, but we're happy to announce that the bivalent booster has been approved for everyone 5 years and over. And JCPH currently has in stock all of the booster as well as primary doses for everyone 6 months and over. And we have those available in our clinic, we're really finally got that in, which we're really happy about. And I don't think that Kaylin is on this meeting, but I wanted to thank Kaylin Bradley for her service this past year. She has been our AmeriCorps Vista Immunization Community Engagement Volunteer and has been just instrumental in a lot of the outreach work and work we've done with outreach clinics this past year related to COVID. So we really thank her for all her work that she's done. And we're getting ready to welcome a new volunteer later in the month, which we're very excited to have as well. And I just want to welcome Sarah Fitzpatrick. She's one of our new harm reduction specialists that we're very happy to have on board this week. So, thank you very much.
Thank you, Gwen. Christine, I saw you a minute ago.
Yeah, good afternoon, everyone. Thank
There
you
she
for
is.
allowing. Yep, I am here. Just a couple of updates from our epidemiology, emergency preparedness, health communications, health planning. team. As part of a follow-up to the work that Jody talked about with staff-involved conversations, I am quite excited to announce that both our EPI and planning team, so all of our data EPIs, as well as public health accreditation, strategic planning, all of that work under our health planners will be moving under my division. So we will, that was a staff-led decision. I am very excited to have them on board. And super excited to help lead that effort with their guidance, fully their guidance, in continuing to do the work that Kelly Keenan had been doing for the department. So a huge thanks to that team for trusting me with the leadership role that they have given me, and a welcome to Team EPID to all of them. Very excited to have that team under my helm. Other updates, as Jody also mentioned, our health communications program has completed their communications plan for the next 2 years. We are hopeful that they will be able to provide a study session to all of you in the next couple of months to provide information on the contents of that health communications plan. Our emergency preparedness team just wrapped up a very great emergency preparedness campaign, both internally and externally. During the month of September. Very proud of them for the work that they have done to promote community preparedness across all spectrums of our community. And we are working hard on a grant, cross-divisional, cross-program grant to advance our access and functional needs planning. So that is some of the work going on as that team works to recover and reimagine after their initial response to COVID-19. Our infectious disease program, both our epidemiology team and our disease investigation team, still hard at work with COVID-19 response, but we are also seeing other respiratory diseases. So a friendly reminder to get your flu vaccination, as well as cover your cough, wash your hands, and stay home when you're sick. So those are updates from our program. I'm happy to answer any questions. And then I wanted to close with a little update to the budget presentation that Salma gave earlier about that ELC grant. We are working hard to petition CDPHE. They are well aware of the need to allow flexibility in that funding. And we have also had opportunities at the Metro Denver Public Health Director's level to really provide commentary, feedback, strong letters of encouragement to our federal partners on the need for that funding to have a little more flexibility in it so that we can respond to other emerging threats like monkeypox and Ebola. So a little update on that in particular. That's all I have.
Thank you, Christine. That's all that we have from the leadership team. Staff comments. Is there any staff that would like to make a comment on anything? I'm not seeing any hands go up. Okay, let's go to board comments. Who would like to make first board comment? Hilda.
Yes, I do. Thank you, Cherry. I would like to take this time to see if we can discuss or have a conversation regarding the request that Haley mentioned earlier in the public comments, the director of Food Policy Council. She is requesting that we support the passage of Proposition FF. And she mentions in her letter that the Jefferson County Board of Education already voted unanimously by everyone. So I'm wondering if we can have a conversation on that and see if we can do the support that the Policy Council is requesting from us.
Lane, you have your hand up? Is it in comment? Is it comment?
No, it was before that. So I'll hold mine until
okay.
this.
we can have we definitely can have a conversation about that. I don't have any information on it. I haven't had a chance to look at my blue book. So I really don't even know what it is that I would be able to vote on. In concept, no kid should go hungry. We should always make sure that all kids are fed. That's hugely important. I think it's important to all of us. I just don't have any information. Usually before you take a position, one way or the other, you kind of hear the proponents and you hear the opponents. And I haven't really heard a lot. The only thing I have heard is in the legislative process, they have some concerns because the funding, it's going to obviously have to come out of the funding. And the thing that always gets hits the hardest, it's awful, but it always gets hits the hardest is the K-12 is the schools. But again, I don't have the information for me to make a decision. Members? Kimberly?
Yeah, I agree. And I apologize, Hilda. I have not had an opportunity to really review that. And I would feel ill prepared to do that tonight on this meeting. But I do want to make a public statement such as Sherry's, is that food security, food care, all of that is essential. And if I have an opportunity to review this, and the question of funding, just in the little I read about it, I wanted to make certain I had a better understanding of, well, if we pass this or whatever, how are we making certain that it will be successful? So that's what I can add to the conversation this evening.
Is this something we can review and do an electronic voting on? Because I don't think it would be timely to wait for our next meeting.
It is possible to do voting through email. Carrie, you would have to help me explain it again because it's really complex, but Lena, certainly something that, could be done.
It is something that can be done. And you're right, Lane, if the board wants to adopt a resolution or a position in support, the timeliness is a factor here. So I think at this point, if the board wants to do that, Lindsay and I can work together, either do it electronically or a quick, quick Zoom meeting. But I think at this point, what I'm hearing is that you all need to decide whether you want to move forward with considering it and direct staff to set a quick electronic meeting.
Let me ask this question for discussion. Even if it's not specific to, because there's a lot of information that we don't have, and it takes time to get it, but because this is an important subject, it's an important topic. Kids should never go hungry. Is there even a possibility that we do some kind of a resolution just supporting the concept even? I mean, not necessarily saying that we have to support FF, but the concept and where we stand on that and what we think without having to take a position. I mean, I don't know. I'm asking. We haven't done a resolution since I've been on the board. So I don't know.
Well, if you don't know, Sherry, I absolutely don't know either, but I don't know if this question is for Carrie. What I can just add is this was brought up as one of the community involvements that I have, and it was in the letter that was sent to us regarding what it will entail or who will be benefit from this. And I understand your point, Sherry, that normally you hear both sides before you can take any position on this. I definitely I think all of us are on the same page. The concept is we don't, in any way or form, we want kids to go hungry, especially when they are receiving education. There is no way that they can be focused without being fed. So the concept is definitely something that I support regardless of the nuances. but I like Carrie's suggestion that we have time to gather a little bit more information, and if we can do electronic voting before the election time, because timing is and the essence. I mean, election time is November 8th, and we're not gonna meet before then. I just think that this will be a good way to support community efforts, because this Proposition FF is led by community members and community organizations who understands the importance of making sure the kids have what they need to receive appropriate education. So,
and you know, these groups have worked very, very hard on this. I do know that.
yeah.
The one thing that I always say is that when things are approved, the voters don't ever go back to, geez, I wonder how this is going to be funded. And then what does that mean? And I guess because I spent 16 years down there doing that, we watch things get passed, and then it's like, oh my gosh, how are we going to pay for this? And inevitably, doggone it, they cut K-12 education, and I don't want to see that. But like I said, I don't have enough information. So Kimberly, you have a comment?
Yeah, so I was just wondering that if as a board, could we set a date? Like, can we all, agree that by next Monday, we would all prioritize doing the research we individually need to make an electronic vote, and then ask Noelle and the comm team, once we know what what the vote was, to have the comm team release that, should the vote of us support it. We know that Noelle is right there, Noelle and her team, excuse me, to get that out, get it on the website, get it, I don't know, a public service announcement, whatever it is, so that we are timely. I would personally commit to having that done by Monday. So it's just, I'm just throwing it out so we can kind of at our time and stuff.
On that, I'll just quickly say that the cautionary note, I can follow up after this meeting, is if, let's say, the Board of Health wants and adopts a resolution supporting the measure, the publication of it has to be done in the normal ordinary course of what the board normally does. In other words, agency monies can't be spent, sending it out through means that are not normal part of the process. So I didn't want to get ahead of ourselves, but I did want to just put that little caution out there.
Lane, you had your hand up.
If we're moving on, I just had other comments. So
is that something that we want
to,
is that something that we want to do? I keep forgetting, Lane, you've told me that it's a separate thing. My apologies. So I need to know from the board members, is this something that you want to do? Do you want to just take the week to come up with a decision for each of us of our own? And I do have, Carrie, a question. If they can't, as the department, can they post it? Is that what you're saying? That are they not allowed to be involved in that as employees of the county? I want to make sure of what you're saying.
So the Board of Health, let's say as an example, the Board of Health adopts a resolution in support of the measure, that resolution, my understanding is that there is one Board of Health resolution posted on the Board of Health webpage. That's where this could go. If there are other normal places that the board uses to post information about board action, that's what could be done. If we wanted to get into something else, I would, just ask to be part of that decision so that we stay on the right side of the Fair Campaign Practices Act.
Right.
I support us, doing an electronic vote.
Okay.
And yeah, Monday's certainly plenty of time.
Okay, it sounds like we kind of have a consensus. We don't really need to vote on that. A consensus to move forward, do our own investigating, and then have everything to Lindsay
Mhm.
by Monday?
So that doesn't need to be in a motion, that process.
No, well, I don't think it does. I mean, because we're gonna vote. We're gonna.
Oh, I
vote.
see.
Do you
Okay.
see what I'm saying?
Sherry,
Yes,
so this would technically be a special meeting pulled together via electronic meeting.
correct.
So
Correct.
Lindsay will need to post it, just like she posts any other meeting. So,
Right.
and there will be a brief agenda, and I will work with her on the script, but it will all be done electronically.
Right, okay.
So just to be clear that it would need to be posted, and there will be a brief agenda, but it will all occur, as I understand it, via email.
Right.
And I see how Haley has her right raise. She's from the Food Policy Council, the person that sent the letter, but I don't know if we need to hear from her right now because she already sent a letter, or
Yeah.
if we wanna extra information.
No, I think that no, because we need to take this time to each reach out and get the information that we need individually.
Sounds
And
good.
then Lindsay, you will do the posting. And so if we need to decide, go through Monday, so you could post it, for like Tuesday or Wednesday. Lindsay, is
Yeah.
that right? Okay.
Yep, that's totally fine. And then it's my understanding for electronic or email meetings that
Mhm.
everybody needs to be on email at the same time. Carrie, you can tell me if I'm wrong, so that it's kind of like a live meeting, but via email. Is that right, Carrie?
That's correct, and you'll have a reply all function, and the public will be, anyone who wants to attend the meeting electronically can ask to be part of the email. So that when it's a reply all, you vote reply all, and the public members are able to attend the meeting and observe it via the electronic means.
Sounds confusing, but that could just be me.
Well, thank you.
It is a little bit cumbersome, and when we discussed it in the past, we decided, and I'm using the general we, not me, decided, but the decision was made just to do a quick Zoom because it was just over and done.
It just seems like it would almost be easier to do just a really fast 15-minute Zoom. Everybody's going to have already made their decision, and that's the only thing we're going to do. And so I will leave that to the members. It's fine with me. I personally think that doing a Zoom would be much quicker and easier.
I agree. And thank you everyone for taking time to do this.
Lane?
Yeah, that's fine.
Okay. I would just prefer that we do that. It's just this going back and forth with emails is going to be chaotic. Well, I think it will be. Okay. So that's what we will do. We will actually, Lindsay will do a special meeting, a Zoom meeting. Just give us through Monday to pull all of our information together, and then we can do it Tuesday or Wednesday.
Okay, sounds good. And I'll send some dates and times for Tuesday or
Perfect.
Wednesday.
And it literally will be about 15 minutes because we won't need to go into a big discussion. I don't think we might. Okay. Other board comments, please. I'm sorry, we got kind of sidetracked on that. Board comments. Lane.
Well, I am very sad to see Kimberly leave the board, but it has been my absolute pleasure to serve on the board at the same time. You've been a wonderful voice for this community, and I will miss you very much. So thank you so much for your service to Jefferson County.
Thanks, Lane. I think Sherry said earlier, you're kind of the senior member now, or you would have been whether I stayed or not. But I just want, everybody to know that when I joined the board, we were meeting in person first in the over at the county building, and I remember the first day sitting down in that chair wondering what I really had kind of gotten into. And you just were so welcoming. And as I shifted notes to you for months and probably a couple of years afterwards, you know, like what's variance and what's 200 feet have to do with anything. You were such a patient mentor to me. And I know you have a lot of responsibilities in public health outside of Jefferson County Public Health and a family. And I just want to publicly thank you for you never falter in providing time to Jefferson County Public Health and to me. And my success on this board in large part has been your support and your education of me. So thank you. And you all will continue to see me on your meetings. I just won't be voting or that kind of thing. So thank you.
Thank you, Kimberly.
Can I take a quick opportunity to also thank you, Kim, for exactly what you mentioned to Len for welcome me and to make me feel like I'm part of this team, for taking me in the trip you wanted to do. It was really nice to be able to have the opportunity to chat and to get to know you, and I wish you the best. And I hope we continue communication, and I really appreciate your support as a new member of the board and any board. I really appreciate your support. And you will
Thanks, Hilda. Our time's been really short, but I will tell you your impact on me is deep. Your passion for diversity and inclusivity and the gentle way you are encouraging and helping our board expand our understanding and our potential to elevate that. I leave really impacted by what you've shared, both on these meetings and the day we were with John. And I wish you and the board all the best, and continue to be that voice, continue to be that educator, because you came and you strengthened us. So thank you.
Thank you, Kim.
And I'll just say to Harriet, because I know she's not here, I leave a better healthcare provider from this board, in large part due to Harriet's commitment to mental health. I have learned so much more, and Sherry, that extends over to you also, with your education to me, in terms of staying away from dualistic thinking, that we as board members have a responsibility to listen to both sides of this community. And over the last year and a half, that has posed challenges, and it's been difficult. And I could not have come out of this on the other side of that, Sherry, without your mentoring, without you really using your experience downtown, as you always say, and helping me to apply that. Even when I have very strong convictions or opinions, I feel better prepared now to be a better listener. So for all of you, I have great thoughts of what you all will continue to do. I want to just take a moment too to thank the executive team. You talk about inspiration, you talk about dedication and passion. Not only did you guys step up, you stepped in, and we all know what I'm talking about. You stepped in, and now you are you've seen the stairway, and you are helping this amazing staff at Jefferson County Public Health walk up that stairway to a very, very bright future. And I'm going to watch it, and I'm going to continue to want to be a part of it in a citizen way. Greg Geronimo said that also, I think, when he stepped down. I'm stepping down as a board member, but I'm not stepping down as a citizen in Jefferson County. And I just want to thank Kim and Casey and all the attorneys that educated me, and Dr. Johnson for taking a chance on me. It really has been a phenomenal opportunity. We aren't elected board members, we are commissioned by the county commissioners, and I would really, really like to thank them as well. I come out of this a stronger citizen. So thank you all, and I look forward to seeing the progress with the new executive director and the person who is coming to sit in my chair. I wish them all the best. They have the best board that they could possibly want to work with. So thanks to all of you. And finally, Lindsay, you and I both know I only sit here tonight because you have consistently been my rock. So thank you, thank you, thank you.
Well, and I will just close with my comments with saying that Kimberly, everyone is going to miss you. You're very thoughtful. You are very thorough. You have been an incredible secretary, I have to say. I have loved how you think through everything. I have really, really admired how you have brought different opinions to the table, and you have just been great for everyone. So I know I'm going to miss you. And I love your sense of humor too. I have to tell you, I look forward when I talk to you about with your sense of humor. So we are going to miss you, and the county's going to miss you. And so please, please stay in touch. I know I still have
Absolutely.
You're on speed dial.
Absolutely.
I'll call you.
Okay.
Thank you. Thank you. Thank you. Well, I think that wraps up what we had on our agenda for today. And if there's no other comments from the board, I will go ahead and adjourn this meeting. And it is 6:06 p.m. And with that, the meeting is adjourned. Thank you.
Thank you.
Bye.
Thank you.
Thanks. Bye.
Bye.
Bye.